Thank you everyone for being here today. I am very pleased and honored to introduce our presenter, Meg Meeker. Dr. Meeker is a pediatrician and best-selling author who has practiced child and adolescent medicine for 31 years. She is the author of 7 books, including the best-selling Strong Fathers, Strong Daughters, Strong Mothers, Strong Sons, The 10 Habits of Happy Mothers, and her most recent book, Raising a Strong Daughter in a Toxic Culture. Dr. Meeker is a nationally acclaimed speaker on parenting issues and has appeared on numerous national television and radio shows. She has spoken at the United Nations about fathers and serves on the advisory board of the Medical Institute. Dr. Meeker has created many online courses for parents, and her podcast, Parenting Great Kids, has reached more than 5 million listeners across the globe. Welcome, Dr. Meeker, and we look forward to your presentation.
Well, thank you so much for having me. You know, it really is an honor to be here and to be able to talk with you. I always feel so excited when I have people who are willing to come and talk and are willing to come and listen about kids and particularly teens, because I love teens. They're my wheelhouse. I've never met a teen I didn't like. So I really would love to talk to you today. Which we're going to be talking about is the effect on COVID on teenagers. And as I was researching it, you know, the primary effects on teenagers have to do with mental health. So that's really what I'm going to focus on today, because this is where our kids really need our help the most. You know, the biggest mental health challenges for teenagers, I'm talking basically 12 to 18 years of age, have been depression and anxiety and post-traumatic stress disorder. And the toll has been very, very high on kids. And take a big deep breath, because the first part of my talk might be a little bit of a downer, but that's what we have to talk about. As a matter of fact, sometimes I was reading through my notes and I was starting to tear up, and I thought, okay, get a grip here. But I want to go through teens and just talk a little bit about why teenagers are such high risk for depression and anxiety during a pandemic like this. First of all, if you think a teenager from a developmental standpoint, and you look at the education, classroom teaching, being with their peers is really important for their cognitive development. Being with peers stimulates their maturity, their brain maturity, the intellectual maturity, their social maturity. And it also fosters that sense, which is so critical for teenagers during that year, of independence and moving away from dependence on parents and adults towards independence. And so when they're quarantined during COVID, it really nullifies that process, because they learn, okay, now I'm stuck at home with mom and dad. I'm not able to be independent. And so it really blunts that maturation process. And even though kids might not be able to identify it, they feel it. And they feel like they're stalled, and they feel like something is wrong, and they feel like, I'm not supposed to be here. I want to be who I am. This is particularly true for junior and senior high school students who are looking forward and planning to leave home, either by going to college or by having a job. It's really critical for them to be able to plan their next year or their next years. And so that's a really important thing that we need to remember. The other thing is that socialization is extremely important for the healthy psychological development of teenagers. During this time and when they're at school, they're trying to figure out who they are. And a lot of this happens in the presence of friends. Teenagers, as you know, if you've had a teenager in your home, are extremely self-centered. And so they're constantly thinking, who am I relative to my friends? Who am I relative to teachers and kids that can perform well here, who get good grades? And their interaction with adults is also giving them cues as to who they are. And it's teaching them how to navigate adulthood. So when you pull that socialization component of their life away, again, that stalls that sense of trying to figure out who they are, because all they have in their social ecosystem, if you will, is siblings and parents, and maybe a little bit more extended family. But they don't have their friends and they don't have outside adults. And so again, that makes them feel more suffocated. And then of course, we've got their brain development. And if you're a really bold person, you can try to figure out the teenage brain. You know, it's a place you enter with caution. You know, but it's fascinating. It's really fascinating. But as you know, the teenage brain is not fully developed. We know that it fully develops more around the early 20s to mid 20s. That means that there's a fascinating growth process that's going, and that's really blossoming during the teenage years. You've got neural pathways that are being laid down, and whatever they experience in their environment influences the laying down of those neural pathways, which is incredible when you think of it. They have this tremendous neuroplasticity because they're not completely developed. So their brain is really kind of blossoming too. Now, when you think about it, and there's some really great studies on this coming out, we know a lot of what affects brain development in kids and teenagers. And we know, for instance, that time on screens has a tremendous impact on brain development. And this is kind of spooky when you think about it, really, because we know that if a teenager spends more time reading, more time dancing, more time interacting with human beings, their brain develops differently than if they're playing video games or watching television or on social media. And, you know, that's why people like me, and probably people like you as well, are always beating the drum to parents. Please, 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 please help decrease the amount of time that your kids are on screens. Now, we know that they're going to be on screens for education, and they have to do that. We also know that kids during COVID have been on screens more, and we need to give parents a lot of grace. It's been hard. My own daughter's, you know, homeschooling her 3 kids, and she's never done it before, and it's very, very intimidating. She's not a teacher, and so the kids end up, you know, watching more television and doing things like that. And so we really, really have to give parents some grace. But we also need to know and understand that this time during COVID, when they're spending more times on screens, is having a real impact on brain development. And that makes your job and my job harder as COVID ends and our kids are going back to school. But that's okay. We can handle that. The third thing that we have to think about with teenagers navigating this whole COVID thing is the lack of mature cognitive skills. In other ways, they don't have the ability to handle trauma and difficulty the way we do. You know, they lack the ability, and a lot of times adults forget this because, you know, boys are shaving and girls are, you know, acting when they're 14, they're acting like they're 18. And we tend to assume because they look older that they think like an older person, but we have to remember they don't. And that's one of the things that you who influence teenagers and parents can talk to parents about, I know your son looks like he's 20, but he isn't. He's only 15. Or I know your daughter looks like she's 18, but she's not. She's 14. And the fact that they're teenagers make disallows them, I don't even know if that's a word, but keeps them from understanding that what is happening today is going to affect what happens in a year or 2 or 5. But it also means that they don't have the ability to see what's going to be happening in a year or 2 or 5. And that keeps them from having the hope that they really should have. So teenagers are kind of stuck in the present, if you will. And we know they're very self-focused, self-centered, whatever you want to call it. And if you're very self-focused and you're really stuck in the moment and you feel trapped, you can imagine that they feel a level of horror, if you will, than we do, because we can think this through. And so we have to realize that they're limited in that way as well. And I think the more we understand how teens think and teens develop and what they need, the better are we able to help them. And, friends, there's so many ways we can help them. We know that healthy teenage development is all about parents and healthy adults in their environment who can come in and guide them and teach them and have a huge impact on their futures. And finally, we know that, well, one of my finallys is teenagers are more likely to hearing about trauma and tragedy and the pandemic over and over and over and over because they're on screens more, and kids are on TikTok, and kids are on their social media, and they're browsing the internet, and constantly they're reminded of death and death and death and death, and pictures of people being put in special housing outside of hospitals because they died. And they hear about, grandparent-like figures who are dying in nursing home. And they just hear a lot about this. And again, because they don't process it the way we do, it's terrifying for them. And I will tell you, I've had 6 and 7-year-old kids come into my office. They are really, really scared they're going to die. And it's hard to talk them out of that easily, because they're on screens more because of COVID, and the television's on more. And then we know that teenagers are on internet more frequently. So they're really getting bombarded with images and thoughts and feelings they don't know how to handle. And so we need to be very, very sensitive to them about the fear that they feel. I think that we as adults feel more frustration and boredom and, concern for other things than we do fear. Personally, if you're a healthy adult and you don't have any underlying illnesses, you think about COVID and you think about getting it, but dying isn't the first thing that comes to our mind. Being seriously ill and going into the hospital. I have tremendous respect for COVID. Don't get me wrong. You see one person die of COVID and it's very, very sobering. But I think we have to be realistic, and statistics are very much in our favor that if we get it, we're going to survive. A teenager doesn't feel like that. Again, they not only fear for their own life, they fear for their parents' lives and their grandparents' lives. And now you've put them in a situation where you've halted their sense of developing into an independent person, and they're with their parents all the time, feeling more dependent on their parents' time, their parents. And now we've got them afraid that something may happen to their parents. And so we can't minimize the effect on teenagers. And all of this is going on in their heads all at the same time. And so we need to be very, very sensitive to it. So that's just teenage understanding 101. So now we know that's what's happening. We have a better understanding of why they may be more prone to anxiety and depression and PTSD, because they've got this brain and these emotions that aren't that are fluid. They're not stagnant or steady. They are just sort of developing, and they're changing and shifting all the time. So if we look at the state of teenagers, the mental health of teenagers before COVID, those in my position, and probably educators as well, anybody that works closely with teens, we know, if you've been in this longer than 2 or 3 years, we know that anxiety and depression in teenagers is on the rise. And that's really, really concerning. And when I finished my residency in pediatrics in the late 1980s, I'm really dating myself here, which is fine. But we didn't have antidepressants. Nobody taught us how to handle depression. Nobody really taught us how to identify it. And anxiety, we were great at taking care of teenagers in the intensive care unit. I mean, we were great at treating diabetes and asthma in our sleep. But nobody taught us how to treat depression or recognize it. The same is true with ADHD. Psychiatrists were handling it. So as things have, as depression has increased over the years, we've had to learn how to identify and be relatively comfortable treating it. So the incidence before COVID of anxiety and depression. Now, I kind of lump anxiety and depression together because they're really on the same continuum. Sometimes it's really hard to tell what's anxiety and what's depression, because a depressed kid will get anxious and an anxious kid will become depressed if they can't break it. So before COVID, the incidence of depression in 12 to 17-year-olds was about 1 in 10 kids. That's still pretty high when you think of it, 10% of kids. You know that suicide is the second leading cause of death in teenagers. That's very sobering in a country that has a mental health facilities that still we don't fund well enough. I don't think we take it seriously enough. It's a different that's a different topic, but it's really too high. More startling, the data before COVID was that in 2007, which doesn't seem that long ago, the incidence of depression in teenagers was 8%. Still too high, but by 2017, it was 20% in girls. That's 1 out of 5, and 7% in boys. 1 out of 5 teenage girls before COVID was depressed enough to get treatment. And that doesn't include the kids who aren't getting treatment, who we miss. And so personally, from where I sit, this is anecdotal, it's my personal experience, but I think the incidence is higher because there are kids that I uncover as having some mild depression or dysthymia as I'm talking to them. And I think if you interact with teenagers too, it's probably actually higher. Post-COVID numbers have skyrocketed. Now, the data is a little dicey because it's only been out here for a year. And so we don't have really good data yet, but as best we can tell, the rate of depression in teenagers now is about 22%. And China studies, which interestingly enough, there are a lot of studies in China that we don't, that more than we have in the United States. In China, it's 43%. That's almost half the kids. And this is 1/5 of our kids. It's everywhere. Many teenagers fare worse than adults, again, for all the reasons that I talked about before. 26% of teenagers have had suicidal thoughts versus 11% of adults. And substance abuse, which of course is very closely related to depression, is 25% in kids and 13% in adults. It's very important because we're talking about high risk behaviors in teens, sex, drugs, and alcohol, that we understand that our kids now are more likely to engage in high risk behaviors because they're frustrated, because they have a mood disorder, because they're bored, and they try to mood alter. They just want to do something. Maybe it's an independence thing. So they're more likely to engage in high risk behaviors. And one of my enormous pet peeves is this, that the medical community identifies high-risk behaviors as sex, drugs, and alcohol. The community at large describes high-risk behaviors as drugs and alcohol, because we're training our teenagers to believe, and parents to believe, it's not a high-risk behavior. It is absolutely, unquestionably a high-risk behavior. Pick up any medical journal anywhere and it's listed, but we're really not teaching our kids. So the bottom line is, our kids right now, as they come out of this post-COVID time and back to school, is that we really have to be on guard for kids who did a lot of, they probably didn't have much sex, they couldn't see people, but that doesn't mean they're not going to be engaging in it when they get back to school, because there's going to be residual depression when they go back to school. And one of the interesting things that we've learned as well is that the longer kids are isolated and the longer they are lonely, the longer their depression will last in the future, maybe up to 9 or 10 years. So the faster we get kids back to school, the shorter the time that they experience depression and anxiety after they get back to school will probably be. And so this is why people like me have been really pushing for kids to go back to school, because we see the bad stuff that happens to kids versus the COVID that the rest of the population doesn't see. Now, whenever I read, I wanted to say too, depression in the pandemic has disproportionately affected communities of color. Blacks, that are about 48% depression, Latinos, 46%, and the LGBT community. So we have to be extremely cautious and alert to kids who are at high risk, and really make sure we're attending to those kids and we're not missing things, because a lot of kids hide their symptoms of depression. They're embarrassed. They don't want to worry people. They don't want to be singled out. And when you've got kids who sort of already feel like they're living on the periphery of friends, they're going to be more likely to be missed, because they're even going to back up a little bit further. But I don't like numbers. And I'll tell you why. I always hold numbers very, very loosely, because my job is not to help 90% of the kids with depression. My job is to find 100%, because if I have one kid out of 100 who has depression, the number for me is 100%. That kid got it, and my job is to make sure I attend to that child. So my job is uncover 100% of those kids. It's easy to find the ones that are obvious. It's harder to find the ones that are more hidden, but that's our job. That's our job, is to dig deeper. So how do we identify those kids with anxiety and depression? Now, as I go through the list, think about this. A lot of these signs, parents pass off as normal teenage behavior. It's another one of my pet peeves. I have a lot when it comes to taking care of teenagers because they're really great. And guess what? They do talk. We just have to learn how to talk to them. And so, so a lot of these issues are missed by skeptics of teenagers, people who marginalize teenagers, people who don't really like teenagers in the begin with, and a lot of parents who just sort of say, oh, my kid's just 15. They're supposed to act like this. They're supposed to spend the whole day in their room playing video games day after day. No, they're not. That's not normal teen behavior. So again, our job as the non-parent is to come in and identify things that a parent may be missing. Because often parents will miss things, not because they don't necessarily recognize those behaviors, but because they see them and they think they're normal, and they really don't want their kid to be depressed. They really don't want their kid to have anxiety and depression because it frightens them. And I get it. As a mom and a grandmother, it scares me, and I'm probably overcautious because I'm always looking for issues and problems that aren't really there. That's when my kids tell me, quit talking to me like there's always something wrong with me, Mom. So we have to be very careful, but we don't want to go the opposite direction too. So here are the things that you need to really be on the lookout for. And I would encourage you, as you start to watch teens, just watch their faces, watch their mannerisms, watch how they interact with other kids. You're looking for a change in their mood or a change in behavior where they're pulling back from their relationships with their friends. They're pulling back from texting their friends, being on the phone, which is another frustration a lot of teachers have, I know. They have lost interest in things they usually like to do. Their sleep patterns are disrupted. They either aren't sleeping enough and they're chronically tired, which means they're a pain to be around and they're irritable, or they're sleeping too much. But again, a parent might say, oh, teenagers are supposed to sleep all the time. Well, not really. They have a change in weight. Either they're thinner or they've gained weight. Usually in teenagers, they've gained weight because they're not moving and they're sitting and they're bored and they're just eating food because there's nothing else to do. They have less interest in schoolwork. Well, normally they have less interest in schoolwork if they're depressed, but many of them really have sort of dropped out right now because online learning, some kids just don't do it well and they're bored and they hate it. My daughter's a teacher of physics and chemistry for junior and seniors in high school. She said, Mom, it's kind of a joke. These kids I can't get them to pay attention. They also have problems with their memory and concentration, and their parents think, oh, they developed ADHD. Maybe not. Depression can look just like ADHD. And so that's just a tuck in the back of your head. They have change in appearance. Sometimes they don't care how they look. Sometimes they've gotten more piercings or tattoos, or they've grown their hair long, or they just don't look as healthy as they used to look. They don't have that spark. And I encourage you, use your gut when you're looking at these kids. Sometimes your gut tells you if something's wrong. And again, parents may have their gut saying, I don't know if this is normal or if it's not normal, but you will know because you've seen enough kids that you know when they're a little off. And if you think they're a little off, they're probably off more than you see because they will hide it. Again, reckless behavior, sex, drugs, and alcohol that maybe they didn't do before, but if they did them before, they may be doing them more. And of course, thoughts of death or suicide. And this is the real big scary one for all of us. I don't want to miss it. I'm afraid I'm going to miss it in my kids, my patients. I know you're afraid you're going to miss it in some of your students. And you know what? You may. And that's just the way it is. Depression is a very serious illness, and it's an illness. It's not just a passing of thing. It's not just something that are in kids' heads. It's not something they can just, pray out of or think their way out of or pull themselves up by their bootstraps. It doesn't work that way. If you've ever had depression, you know it's horrible. If you hear kids say things like this, big red flag, you know what? Nothing matters in my life. And they may say it to their friends, but again, you're listening to those conversations and you are allowed to listen. Forget this privacy thing. Our kids don't do well with privacy, which means we pull back. So we've got to, sort of invade their space a little bit very quietly so we know what's going on. So if they say things like, nothing in my life matters, I wonder how many people would come to my funeral if I had a funeral. Sometimes I wish I could just fall asleep and never wake up. Or, if I were going to kill myself, what way would I do it? Or, everybody in my life would be so much better off without me. My parents would worry less. And I know they say they love me, but the truth is I'm such a pain and I'm such a burden. Life would be better without me. And, or they'll say things like, what, don't worry, you're not going to have to worry about me much longer. So if you hear those things, you need to, in private, pull that student aside and sort of say, what, I heard you say that, what's going on? And if they say to you, oh, I didn't really mean it, don't believe them. Kids just don't sort of wantonly say that. And even if they are saying it to impress a friend, you have to take it seriously because we just don't know. And some kids do say things just for shock effect. But from where I sit and for where you sit, we don't know which is a shock effect and which is really real. So we have to take everything very seriously. So now let's go a little bit deeper. What's really going on here? What is really going on? What is causing depression in kids? We sort of know developmentally, and we know that they're at risk, and we know they're lonely and this kind of thing. But why are they getting depression? That's the $1 million question. Because if we can understand the why, then we know the what. Okay, I know what's going on inside of you, kid, and I know what's going on in your brain and your, cognitive development and so on and so forth. But I need to know where depression is coming from on a deeper level so that I can really help you. Well, research suggests that depression doesn't come from simply having too much or too little brain chemicals. Yes, brain chemicals have a big effect on depression, but there are many causes of depression. There's situational depression, where depression comes just because of a situation, like they're stuck in their house with their parents and their younger siblings for a year. They could have faulty mood regulation. They were never taught how to regulate and handle their feelings because maybe they had parents who couldn't do that. Maybe they are genetically wired to become depressed more easily in tough situations than other people. Maybe they don't react to stressful life events the way another teenager might. Maybe they have a medical problem like Crohn's disease or juvenile rheumatoid arthritis or, lupus or something like that, who already makes them feel like they're odd. And now you add COVID on top of it, it just sort of pushes them over the edge. So the specific causes of depression in teenagers are loneliness, the experience of loss, or fear of loss. Okay, because loss or the fear of loss can feel just as bad as loss. Maybe they've experienced the loss of an aunt or an uncle or grandparent, or maybe they've experienced the loss of a friend's aunt or uncle or grandparent. Maybe they had childhood trauma, and many teenagers have learned patterns of negative thinking. And you hear this, oh, I'm just too fat. Oh, I'm just too skinny. Oh, I'm just too tall. Oh, I'm just too dumb. Oh, I'm this. Well, that's learned patterns of negative thinking that they need to break. Now, you're not going to really have the time to break them. I mean, you can say positive things to them, but you're not their therapist unless you are a therapist. I wish I could see you all, but let's dive a little bit deeper here too. Now, there are students who go through COVID and have all of the developmental issues, if you will, that other teenagers do. They all have the same, but they don't get depressed. So why does it affect some teenagers more than other teenagers? And that's important to understand. Well, first of all, many teenagers haven't been taught how to develop healthy ways of dealing with stress. Now, I'm not a person to pin things on parents, but a lot of their behaviors of dealing with stress are mimicked and learned by what they see other adults do. And, if they grow up in an environment where they're not allowed to be mad, for instance, because one parent is a yeller, or one parent is depressed and they're so absorbed with their depression, they can't help it, that it isn't okay for that teenager to express themselves. So they learn, no, I can't express it. So now their way of dealing with depression in a really healthy manner is disrupted. A lot of teenagers, quote, swallow their feelings, if you will. And if you're a person who swallows your feeling, a lot of conscientious people do. And studying teenagers is interesting because it teaches you to learn a lot about yourself. But a lot of kids don't develop healthy ways of dealing with their emotions, and they swallow them because they don't want to upset their parents, even if they have a healthy, wonderful home with healthy parents. They don't want to upset their parents. They don't want to burden their parents. They're very self-conscious in front of their kids. They don't want to be the mental case, if you will. And so sometimes it could just be their personality. And sometimes the kids do the opposite of swallowing their feelings. They become explosive. They don't understand their feelings, so they don't know how to regulate their feelings. So they just yell at everybody, or they're just a pain to be around. That's a big red flag for depression, is the obnoxious kid in your class who's mean to everybody, the bully. That kid's depressed. So over time, when kids don't know how to handle their feelings, the feelings are unresolved, even in the yeller. They have anger and sadness they have never dealt with, and they don't deal with them. They don't deal with it. Over time, they become depressed. And the negative feelings that they have, because they're teenagers and self-focused, they take responsibility for. So now they feel like something's wrong with me. I'm depressed and it's my fault, because they feel like it's always their fault. Okay. So at the heart of depression is self-loathing. I hate me. That's at the root of depression in any situation, teenager or not. So they have these feelings of self-loathing right at a time when they're trying to figure out who they are, and they feel like they can't, or they feel like, since I don't like myself now, my future, which is, tomorrow and next week and next month, is bad because I'm a bad person. And then they feel hopeless. Well, now you compound that hopeless feeling and feelings of fear on top of that, and you've got a mess. And that's why some kids just don't deal with this very well at all, and they become depressed. Some kids, however, who have learned even a few basic skills of regulating their emotions and dealing with their emotions don't get depressed because they're able to process their fear and their anxiety and their worry about their parents dying. They're able to bring that out and articulate it. And that's one thing you can really help kids with, is to sort of help them pull those emotions out. Kids are also extremely sensitive to others' perceptions of them, particularly their friends. Okay, you know that. You know that. That's why kids just freak out if they have a pimple on their face. Um, COVID has given kids a lot of losses. And if they don't know how to grieve their losses, that's when they get depressed. A lot of the losses are not conscious to them. They lost sports, they lost their proms, they lost graduation, they lost continuity of relationships, they lost normal intimacy of those relationships. And they lost opportunities. I had a wonderful kid that I knew for all of her years growing up come into me, and she couldn't go off to college that she'd worked so hard to get into. And she went from the happiest kid I'd ever known to really depressed in September and October. I mean, really depressed. And it happened just that way because she lost what she'd worked for so many years. And again, because she thinks in the present, she couldn't get herself to feel happy because next year she was going to go. They have fear, they have trauma, they have loss of control. They worry about school and college. They're frustrated over school because maybe their grades have nosedived. Many kids in high-risk neighborhoods lost food. Maybe they have dramatically increased loneliness because their parents are off to work and they're home alone, particularly if it's a single parent. And again, it magnifies their loneliness and it just all snowballs on it. So we know that kids have these enormous losses. So now we need to know, and I don't have much time left, but what do we do? Okay, that's what can we do? And that's what's really the meat of what we're talking about here. And I want to encourage you, even though what I've just talked about may feel very overwhelming, it isn't. You know, all we need to do is look at these teenagers and know you're a gloppy mess. Okay, you've got a lot of things on the inside that are all tangled up. So I'm going to help you begin to identify that mess and start on your way out of it. Okay. Now, you know, unless you're a psychiatrist or a psychologist, which I am not, you can have a profound effect on getting that student to begin to come out of the depression. First, keenly observe your teens. Watch their faces, watch their interactions. Have they changed? You know, and even if you don't know the kid, are they normal? Again, use your gut. Okay, your gut is not going to lead you astray. Second, don't stress over over feeling you can't fix them. Don't stress over it. You can't. It takes a team, but you can help their parents and your school counselor identify symptoms of depression. And you can develop a healthy relationship with that teen so you will become a person of trust that they won't feel embarrassed showing you issues that they have. And you can be that person who identifies problems and gets them to the right people to help. If you identify depression, tell their parents, first of all, if this isn't realistic, because you know their parent isn't in a position to handle it, go to your school counselor if you can. Go to somebody. Go to a friend. Go to their pediatrician. You know, pediatricians or their interns are great places to start. You know, we can get these kids channeled wherever they need to be. And then you can do things like, and don't be afraid, ask teens questions. You can do it individually or as a group. These kids are going to want to talk about what's just happened to them over the past year. They really do. You could talk to them about COVID realistically and tell them things like this. COVID is not a kid's disease. And if you're under 18, it's not a problem that you most likely are not going to deal with in yourself. And if your parents are otherwise healthy and they get COVID, the chances of them dying are very, very small. Kids hear all the bad news about COVID, but you need to tell them the okay news about COVID, and you need to be very blunt about it. That's what I tell kids in my practice. That's what I tell my kids and my grandkids who are scared. So don't live in fear. COVID will go away, and it's not a kid's disease. Next, you need to give your kids hope. One of the most important things we give kids who are discouraged and depressed is hope. You can't see the end, but I can see the end for you. You can't see that your life is going to come back to normal, but I can tell you it will. Okay. You have hope. You are going to get out of this. Even if you have terrible depression, anxiety, it's treatable. Depression tells you you're stuck, nothing you can do. Don't let kids feel that way. You have hope. COVID's going to pass. We can help get you, pull you out of this. Discuss COVID as their problem. Their feelings aren't their problem. Separate the problem they're feeling because of COVID as separate from how they feel about COVID. Because kids feel like they're the problem. They feel like their feelings are their problem. That's not the problem. The problem is the illness that they feel because of COVID. And then move from general to very specific questions if you feel comfortable. Conversation starters. COVID's been tough on you. How has your life changed? How has it affected your family? How has it been for you being out of school? Was remote learning harder or easier for you? And listen to their answers. And the quieter you are, the more they'll talk. Help them tell their stories. Kids love to talk about themselves. So the less you talk, the more they'll talk. So if they start to tell you a story, tell me more. If things are going well in your conversation, dig a little deeper. How did it feel being stuck at home with your parents? Did it make you feel differently about your parents and your siblings? Did you get along better with them or worse? Watch for their reactions. Some kids may not be able to identify their feelings. Give them an emotional vocabulary. Do you feel angry when this happened? Did you feel sad? Did you feel guilty? And so forth. And tell kids that depression and anxiety can cause them to do things they wouldn't otherwise do, or can cause them to do more things that were bad for them than they used to do. But do it privately. If you find that a kid is really bad and is drinking and using drugs and acting out sexually, do it privately, because there is this sort of syndrome of monkey see, monkey do, and kids, suicide can be contagious. Make sure kids are getting outside, encourage a routine, discourage video games, and remember this: you may be the most influential person in that teen's recovery. Don't be scared, but be confident. Listen to them. Do not judge them. They'll tell you more if they feel you're not going to judge them. Regardless of your relationship with them, know that you can make a life-changing difference in that kid's life. You can get through to them, and most importantly, give them that hope that they need. Okay, I think we're going to open for questions now.
Yes, thank you so much, Dr. Meeker. We have received a question. The first one is, do you have a podcast that focuses on this public health emergency as a result of COVID that we can share with others who are not on the call?
Sure. I have a podcast called Parenting Great Kids, and I did one podcast in particular that might be helpful. It's one where I did it with a psychiatrist, Dr. Weckstein. If you go on my website, meekerparenting.com, you can see every podcast I did and who the guest was. So look for Dr. Weckstein. It's on anxiety and depression in kids, and that will give you a place to start in dealing with kids, because depression post-COVID is depression just like everything else, but we have different things that cause it. So go to that podcast.
Okay, thank you very much. All right. As schools begin to open, do you think schools will establish more aggressive ways for students to talk about what is going on with them one-on-one and in groups?
Yeah, some will and some won't. And honestly, it depends on the teacher. Some teachers are fabulous at connecting with kids and they dive in. Other teachers who feel like they're kind of bored with their job and they're disinterested will not. And so I would encourage your teachers and support your teachers, again, as parents. And if you think your teacher is hesitant to do this because they feel unqualified, encourage them to do it, because kids will open up to teachers where they might not with their parents. So encourage parents or teachers to ask, and even some of those very simple questions I gave at the end of my lecture, encourage teachers to ask those questions to the class, and kids will get things rolling. Once kids start to talk, they won't stop. So all a teacher needs to do is really just start conversations, and kids will take it. So encourage your teachers to do that.
Okay, great. Thank you. Can you discuss more about suicide being contagious, like some information backing that?
Yeah. Boy, I should have given you my bibliography here, and I can post it if people would like that. But it is well documented that kids in particular follow trends that other kids start, particularly if the kid who committed suicide is one they looked up to or they thought was cool. Now, remember, kids, depression says to them, there's no way out. Okay, there's no way out. That's what it says. It talks to them. You're stuck. Life's never going to get better. Nobody wants you. You're a burden. What are your options? So if they see somebody that they liked utilize the option of suicide, they feel it's an acceptable option for them. But remember, they're not looking at how it's going to affect other people, their parents, and they're not going to think ahead, gee whiz, I'm going to be dead next year, and I'm not going to reach 35. So they're seeing the here and now, and they're seeing suicide as an option. And we have a hard time getting that through to them. So that's where, for want of a better word, suicide becomes almost fashionable for kids. It's something that they do that's going to get them attention, but they don't realize, that it's going to kill them. I mean, it sounds complicated and goofy, but they can't think suicide through the way we can. I guess is the best answer for that. And that's why it can become a short-lived fad. That's why you want to talk about suicide to one kid at a time. You don't want to talk about it in class. You can talk about suicide in general, but you don't want to talk about a specific kid thinking about committing suicide in general, in the whole class.
Okay, thank you. Is speaking to youth about their actual personal risks of COVID in your example, how effective in comparison is messaging about their personal choices and empowering them to protect themselves? Example, wear a mask, avoid large gatherings, etc.
Again, if you think of the cognitive development of a teenager and the fact that the frontal cortex its prefrontal cortex is not fully developed. That's the part of the brain that teaches them how to understand future and past and to do more abstract thinking. In other words, it doesn't allow them to fully believe action A today is going to affect my the result B in a year or 2 or 3. That's why they're bigger risk takers than adults are. There are some kids at 15 or 16 or 17 who really believe they can get in a car, drive 90 miles an hour down a country road, hit a tree, and get out of the car and come home for dinner. So getting risks across to teens is hard. You can get them across to some easier than others, but I think the very best thing to do is to make it acceptable and almost cool and socially responsible for a group of teenagers to wear a mask and take precautions, because they're more likely to respond to group activity than to personal responsibility, because they really have a hard time understanding, if you don't wear a mask, I could get COVID in 6 months and give it to my mother and she'll die. But they will go along with group thinking, if that makes sense.
Yes, absolutely. Thank you. All right, the next question, there's 2 questions. How would you reconcile the benefit detriment balance when it comes to teens gaming in multiplayer games where they are socializing with friends in lieu of real life interactions that they don't have the opportunities to take part in?
Mm-hmm. Well, I feel strongly from where I sit, because that the kids should participate in sports, particularly outdoor sports. We know the way to contract COVID is through contact face to face with somebody where you're closer than 6 feet apart for an extended period of time, 10 or 15 minutes. If you think about teenagers who are on, say, a football field or a soccer field, they're interacting with kids, but very quickly. And so I think the risk of contracting COVID in that setting is lower than we think it is, but it's still there. But I think the benefit to kids of being on the field, as we've just talked about, all the risks that I just talked about of getting COVID outweigh the benefits they get from playing sports on all different levels, outweigh the risks of contracting COVID and getting sick themselves. And if they have a loved one at home, for instance, who's 75 and is being treated for cancer, keep them away from that person. So be reasonable in your risks, but don't be fearful, because I really feel we need to get our kids back engaged into society and on sports, because they're really, really suffering.
Okay, great. And the second part of that question, you've answered part of that. Is there any benefit, or would you consider this wholly detrimental because it is a video game?
Because it's a video. You mean watching a video game? Yeah. There's nothing. Yeah. There's no substitute for real life. And the difference between, and we have a lot of data coming out now on the effect of video games and boys, because boys are the ones that tend to watch them. And we know the effect it has on, neural pathways and neuroplasticity. And the bottom line is the effect it has on the brain is very different from the effect that real life engagement with people has on the brain. So we do know that is a very different effect, videos versus real life, and that whenever you can opt for real life, do so. But I want to say this, if you're talking about a video game where a kid is sitting there playing, a soccer game with friends and, or a football game on the internet with friends, it's much better than playing a violent video game where heads are being knocked off and blood is appearing and that kind of thing. So not all video games are themselves, but if you can, get them play real soccer, and don't do it on a screen.
Okay, great. Another question is, could you please give us some suggestions on how to encourage youth to share their story? To
Oh,
openly share.
wonderful, wonderful, wonderful. I think the best thing to do is to lead with questions that are going to pull emotions out of them. Like, but you can't start off with them. So you'll say, for instance, boy, it's been tough with COVID. For me, it's been really hard to be stuck in the house. How have you felt? Or, have you been stuck in the house, and what's that been like for you? And they say, oh yeah, it's terrible. Well, how is your relationship with your parents changed? Oh, they just yell at me all the time. What does it feel like when I'm not I'm not going at parents here, but what does it feel like when they yell all the time? Oh, da, 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 da. Does it make you angry? Does it make you sad? So again, you begin to identify their feelings, and if they can't put a name to it, you put a name to it, or say, is that sad? Is that angry? And then you just sort of talk to me about that. The other thing that's really important is to let them tell their story. So, tell me a story when your mom yelled at you, and what were you doing? What was your tone of voice? And what did you do right after that? Because kids love to tell their stories. So engage them in that way, and that will help pull them out.
Okay, great. Thank you so much for those suggestions. And thank you, Dr. Meeker, for your presentation. It was excellent.
Great.
Um, Please feel free to continue to ask questions in the chat. And thank you again, Dr. Meeker.
Thank you.